Hello. It looks crooked. What did I do here?
I don't know.
No one knows. Our world is just tilty. Oh, and I'm hitting buttons. Oh my gosh. Production quality is amazing. There we go.
Yeah.
My hair's sticking out, but that's cool. Whatever. We all
fine.
have those days.
Yeah.
That's fine. That's fine. So today, we're going to talk about
Hypothyroid.
hypothyroidism. Yay! Because last week we talked about.
Hyperthyroidism.
Yeah. So that's why I picked this song.
Yeah.
Are you excited?
I am. What song did you pick?
Did you hear it when I was playing it?
Huh. I probably did, but I wasn't paying attention.
You probably don't even know it. You know it? He's not impressed. I won't play it anymore. We'll get in trouble.
Yeah.
Get it? Because they're opposites.
They are. They are opposites.
It's like a children's learning show.
Lord.
Let's talk about opposites today. And the color purple. And the letter T for tall teeth. Oh gosh, she doesn't. Well, she knows. We watched YouTube videos with the letter people, but she didn't experience that back in the day.
Nope.
But I did.
Nope.
And it's really weird now to watch it.
They're really weird.
Like, how were we allowed to watch that? I don't know.
Yeah.
So hypothyroidism is what, Crystal?
It's an underactive thyroid.
Mm-hmm.
So they're not producing enough thyroid hormone.
Correct. Yeah. So versus hyperthyroidism, they were producing too much thyroid hormone. So there's a lot of, again, thyroid hormones used by a lot of the cells in the body, the vast majority. And so it strongly affects the metabolism is a big thing, hair growth, nail growth, all kinds of things. So what kind of clinical signs do we see with hypothyroidism?
They're usually overweight.
Yeah.
They may have some hair loss.
Where specifically?
Bilateral flank alopecia.
True. Yeah.
So it's going to be like on their side area.
Yeah. So when we see in hormonal diseases, when we're seeing hair loss, so like hypothyroidism, Cushing's disease, those guys, because it's a hormone disorder, typically it is bilaterally symmetrical, and it's usually kind of like on either side of their back or their flank area, and that's, like I said, it's pretty darn symmetrical. It's not going to be exact, but pretty darn symmetrical. So if it's just on one side, it's probably not hormone related in any way, but worth looking into just to be sure. But typically, hormone diseases, symmetrical. So what else? You said overweight. Oh, where else do they lose hair? This is another classic sign.
Tail.
Tail.
Yeah.
Yeah. They have the rat tail. So their tails like go bald. It looks like a sad little rat tail.
It's really gross.
It's kind of creepy.
Especially on the little dogs.
It's kind of creepy. But yeah, so that's another classic sign of hypothyroidism. Obesity is a big one, especially these are dogs that aren't just overweight, but they're not eating much. So when we check their calorie intake and like you're 100% honest about what you're feeding your pet, what they're getting,
ingesting is
counts as calories. So when we total it all up, if we're like, gosh, that's only enough for like a 20-pound dog, and your dog is like 80 pounds, that's weird.
And 20 pounds overweight.
That's a big key too, is that they're not eating much, but they're gaining weight, the hair loss. Sometimes they'll have what's called kind of like a tragic look at their face. They just look sad. They look sad.
Like you all the time.
Like me. So sometimes, they just like, it's a little just droopy and just sad looking. They can also have some different like nerve dysfunctions and things like that.
Some aggression.
Sometimes, yeah, we can see personality changes with it. They're typically more lethargic. They also may be like heat seeking because they like run cold all the time versus the hyperthyroidism. Hyperthyroidism. Yeah, like me. Like I was like sweating all the time.
Mm-hmm.
Not anymore. But yeah, so they typically like they're hanging out by the heat vents and stuff. They don't want to go outside in the wintertime. I mean, nobody does, but yeah, so that's the typical hypothyroid. And again, this is dogs. The vast majority of the time, it is incredibly rare to find a cat that is hypothyroid that hasn't been through like some kind of thyroid treatment or something, you know. But just on their own is hypothyroid. That like almost never happens. So yeah, we're typically talking about dogs. Very common in like labs, Goldens, so like the retriever type dogs. We see it in the pitties. We see it in a lot of different breeds. It just seems like those guys are more common.
Yeah.
So how do we diagnose it?
Blood work.
In coffee.
Thyroid. Total T4. Free T4. All of the above.
All of the above. Okay, so
I never know exactly what you're asking because I'll say blood work and you're like, but what exactly? There's many.
There's many things.
Yeah.
So let's say just a general chemistry panel. Do you know what we like? We haven't checked the thyroid level yet, but just a general chemistry. What is one thing that will be? I will tell you, it'll be elevated. Typically in dogs with hypothyroidism. Do you remember? Because it's really not significant any other time in dogs when it's elevated.
No, I don't know.
Cholesterol.
Ah.
So we do run cholesterol. It's part of a lot of chemistry panels in dogs and cats. We don't worry. It's not like for us, like where they're like, oh, your HDL and your LDL and blah, blah, blah. All the LDLs, the medical nonsense. So it's not like that, and we're not worried about them getting like heart disease from too high cholesterol or anything like that. But it is a sign of a couple different things. One, if the cholesterol is low, that's a sign that maybe there's a problem with the liver, because the liver is what is responsible for making cholesterol. So maybe it's not able to do its job properly. Bless you. We need to do some more. We're looking into that. Or if it's high, that can be a sign of hypothyroidism as well. How about that?
How about it?
But typically, we also will run a thyroid level, and depending on how much we think that they really have it, versus just doing like a screening test, we may run a couple different things. So if it's just like, we're just kind of screening, we don't necessarily think that there's any signs or symptoms, but maybe it's just part of a routine wellness panel. He's being really cute. We will run just a total T4. The problem with that is that total T4 can be low for a lot of different reasons that have nothing to do with the thyroid gland. So they can get what's called euthyroid 6 syndrome. So that total T4 is reading low because they have something else going on. Because they're stressed, or maybe they've got allergies, or maybe they've got a bladder infection. Something has nothing to do with the thyroid gland. And the problem is, if you start them on supplementation based on that number alone, what you're going to do is, because they're getting it from an outside source, their thyroid gland then turns off. Because there's all this whole like feedback loop that's happening in the body, where their body produces thyroid hormone, and what is telling it to produce that thyroid hormone will decrease as the thyroid hormone increases in the system. Does that make sense?
Yeah.
Is that clear? Okay.
Yeah.
And so if we start administering thyroid hormone, then it's called TSH. The TSH will decrease. And so then their normal thyroid production will decrease.
Their body's like, oh, we don't need to make it anymore.
They get lazy.
Yeah.
And they're like, all right. I mean, if you just go give me a pill instead, that's fine. That's cool. And so, that can certainly affect things too. And then you stop it, and then there's problem. It's a whole thing. So that's why if I really suspect that they are hypothyroid, or if that first screening test is showing low and we want to look more into it, we'll go on to do some further testing, like a free T4. So free T4 is a better read of actually what's happening as far as their thyroid gland production. So if that one's low, then typically, yeah, they really are hypothyroid. He got bored with us.
Yeah.
He's gonna go sleep on the floor. And so then based on that one, we'll potentially treat. But so there's a couple different tests that we run, and I usually do like a full blood panel and kind of it's put together the puzzle pieces, and everything fitting together. Are the clinical signs there? Yes. And is that, maybe total T4 low? Yes. Okay, then let's look at this other thing. Is it all consistent? Does it all go together? Then yeah, they probably really are. And then we start them on thyroid supplement, which is a pill. It's just a daily pill. Levothyroxine.
Thyrazine.
Thyroid tabs. Ooh, jinx. Tell me a Coke.
I was going to say, you don't really even need me here today.
You're just here to look pretty.
Well, I'm not doing a very good job at that today either.
It's all right. So let's see. What else? So then what do we need to do for follow-up? We start them on supplement. Okay, now what? Nothing?
Check blood work at least once a year to make sure that their thyroid isn't getting too high now.
Yeah. Or
They
too
were,
low.
yeah, we're too low.
Mm-hmm.
They were low. Now we're giving them the thyroid supplement. So now they have the potential of getting too much and getting high.
Not getting high, like.
Not yes, not yes. Not getting high.
So usually, when we start them on thyroid supplements, I will recheck a thyroid level in a month or two after they start, just to make sure that we're supplementing enough, not too much, not too little. Sometimes there's dose adjustment that needs to be made because there's a starting dose, but it's not what works for everybody. So based on that, we'll adjust numbers if we need to. If everything's perfect, great. Yeah, 1 to 2 times a year is when I typically will recheck and just make sure everything's going good. It is something that they need to stay on lifelong. This is not something that is curable. This does not do 30 days of this medication and they're fixed and you're good forever. Because I've run into that a couple of times where maybe I wasn't clear and they gave it for a little while and then a year later they come back and they're like, that didn't really seem to work. I'm well, it's because you were supposed to keep giving it forever.
You stopped a year ago.
Yep, it's not going to work if you don't give it.
Yeah.
But as we correct that thyroid, what should we see?
They should start losing weight.
Mm-hmm.
They sometimes more active.
Mm-hmm. Yep.
The hair will grow back.
Yeah, typically. Yeah, all those signs, a lot of that will reverse. So that's cool. That's a pretty cool thing.
Yep.
So they typically, they do really well. The medication itself isn't expensive. Really the diagnostics to get to a firm diagnosis is probably the most expensive part of it. And even that's not horrifying. But yeah, and then follow up, like I said, once or twice a year, we check another thyroid level. That's not so bad.
Yeah.
And we usually combine that with their wellness visits and no extra trips. What? Oh, Jay-Z face. It hasn't made it over here.
No? Oh, it will.
Your nose is better than mine, though, I think. So I don't know. Oh, Jace. Drugs.
We should show his ear. We
can show his ear.
had a video.
It's still sad looking.
Well, it is, but it's way better than what it was. We had that video, a couple months ago? About the oral hematomas and stuff. Well, he had his surgery over a month ago. His ear looks pretty darn good compared to what it was.
It's not all
Jace.
blowed up anymore. He's like, I am napping, Mom.
Come here. We're going to show your ear.
He's like, what? Turn so you can't see that ear?
Yes. So it's all
Nobody can see that.
scarred down. No?
Here,
Oh.
let me turn it.
Well, here.
And do some way. Oh, you're gonna.
I am. I'm gonna zoom
my!
in.
This is frightening. People are
So
gonna get motion sick.
It's a little scarred. I still don't know that you can see it.
Oh, we saw it for a second.
It's a little scarred still, but it's not all blowed up like it was. You want to say hi to the camera?
Oh, he's cute. He's a good boy. He's such a good puppy.
Oh, there we are. Okay.
He's a good puppy, aren't ya?
He's the best boy.
Yeah.
My favorite.
Yeah.
Aren't you?
We did. Yeah, we cleaned your teeth, and then you got your ear fixed.
Mhm.
It was a whole very eventful day.
Yeah, he wasn't excited about it.
He also was not excited about wearing the cone, but
No.
we
It
do
was
what we
pretty
gotta do,
good.
bud.
Yeah.
Do what we gotta do.
So he's way more comfortable now.
Mhm.
Right?
Yeah, and that was a good burp. And he also had a secret ear infection that he wasn't telling you about, so that was
Mhm.
cool, which we didn't find out about until we got in there. Huh. Yeah, because you didn't tell anybody.
Yeah.
Yeah, the outside looked totally fine, normal, but then looked down in there while he was sleeping, when he would let me look all the way in, and yeah, there was some redness in there. We took some swabs, and there was some infection, so that may have been what triggered the hematoma to begin with.
Yeah.
We don't know.
Because I told her, I was like, he hasn't been shaking. Like, his ears look fine.
Mhm.
No. Little
He's
turd.
so cute. Oh,
He's a good boy.
good boy.
Yeah.
So if anybody has any questions about hypothyroidism, maybe next week we'll do Cushing's, because they're kind of related.
Yeah.
You're like, I don't want to talk about Cushing's.
I know. I know very little about Cushing's disease.
We'll talk about it. You know more than what you think. You always know more than what you think you do.
Well, it's just, you've told me about Cushing's a lot. And it's so much information, it's like overwhelming. And
We're
it's
not
hard to
gonna get
remember.
like nitty gritty into it, so it'll be fine.
Okay.
We'll keep it light and airy.
Frothy.
Frothy.
Where is that movie
you
from?
know what?
Light, airy, frothy. What is that from?
I don't know.
Light and frothy. I don't know. I'll have to think about it. I'm sure someone on here
Probably
watching.
some
will-
child's movie. It's probably like Frozen 2 or something, because you've seen it 500 times.
It's not Frozen 2. I would know if it was.
Anyway, so I think maybe next week we'll talk about Cushing's. We'll try to keep it brief. We won't go into crazy detail because number one, no one cares. Number two, just way too much information. But we'll talk a little bit about what signs and symptoms we see, diagnosis, treatment, kind of similar to what we have done with the thyroid disease. So, do you have anything else that you need to mention?
No.
Okay.
I don't think so.
Okay. Good deal. All right, then we'll see everybody next week. Bye. Are you gonna hit it?
Sure,
Are
I'll
you
hit
gonna hit the right button?
Maybe. I can't. No problem.